will not believe I had a patient who's been trying for 13 years and she comes with such a big file. I think she's visited every gynecologist in her district who have put her to the same kind of medication, and she comes now at the age of 40. So this is the biggest challenge. You are reaching your fertility specialist late.
How has the treatment in male fertility evolved?
With advent of microsurgical treatments, we have something called TISA, micro TISA. Now suppose there is a husband who's done his semen analysis and it says 0 sperms. The immediate option does not have to be donor sperm. So I think this is a beautiful thing that people should know. You don't directly have to jump to donor sperms, and you can still father your own baby even if you're producing a few sperms. And I think every time I help a patient get pregnant and I see that smile on their face, that contentment, I think I feel very happy, very satisfied.
Welcome to Fertility Tales powered by Nova IVF, the space where we navigate the complex journey of fertility together. I'm your host Simrat, and today we are talking to Dr. Hima Deepti, a renowned fertility consultant at Nova IVF Fertility, Hyderabad. Dr. Deepti is not only a seasoned obstetrician and gynecologist, but also a senior fertility specialist. She is an adept laparoscopic surgeon with 15 years of experience under her belt. Her dedication has helped thousands of couples towards parenthood. Dr. Hima Deepti, it's an honor to have you with us today.
Thank you, Simrat.
Let's start at the very beginning. How did you find your way into fertility or reproductive medicine, and what keeps you motivated to help couples who are facing fertility challenges?
I think my journey into this field, into reproductive medicine or infertility it starts off quite early in my life.
Oh.
I'm a daughter of 2 doctors, and my mother was a very, very committed obstetrician and gynecologist.
Oh, so you followed her footsteps.
Not just followed her footsteps. I think I had this chance of understanding women, understanding their problems from quite early in my life.
Okay.
And I always wanted to be a gynecologist. And when I entered my MS OB-GYNEC, that's where my exposure towards infertility or the patients who are suffering for pregnancy is increased. And I think that has motivated me to take this branch, because 10 years ago, this was not a developed branch as it is now.
Right.
And we did not even have proper training in the country. So, I actually flew to USA, trained myself, learned the latest, came back, and that is how I started practicing. And I think every time I help a patient get pregnant and I see that smile on their face, that contentment, I think I feel very happy, very satisfied. And I feel this is my way of giving back to the society for all the good things that the higher power above has given me.
How lovely.
So much of contentment in this field.
That's true. That's true. Doctor, with your vast experience of 15 years in this field, how do you think the landscape or the fertility landscape in the country has changed? What has been the prevalence or the access? How has that changed?
I think there is a lot of change in the trend of patients that we see over the last 10-15 years. Earlier girls used to get married early, so they had pregnancies early. So the kind of patients that actually landed with a fertility specialist, they were patients who had tubal blocks or some major medical complications preventing pregnancies, or a husband who had a major male factor infertility.
Right.
But now with the changing trends, the lifestyle modifications, the exposure to the environmental pollutions, their commitment towards work.
Right.
People want to first settle down professionally and then plan up their pregnancies. The kind of patients that land up with a fertility specialist is quite different. We have one set where the couple is married in their early 30s, but they do not want to plan up a pregnancy at that stage.
Right.
Because they want to settle down professionally, have a financial stability before they plan up their first baby. So they're actually planning up the baby at a later phase. So they end up in a fertility center. Then we have another set of patients where they're married late. Marriage at 40s is quite common these days, whatever the reasons be. Now it is their choice, right?
Priorities have changed.
Correct. So marriage at 40, definitely the egg quality reserve is going to come down, the sperm quality and abnormal sperms are going to increase. So this is another set of patients we commonly see. And the third category, where women or men want to freeze their eggs and sperms. I'm speaking about social freezing.
Right.
So they're so aware of the impact of age on fertility. So then they enter the fertility center, they want to play safe. So as a backup, they freeze their eggs and sperms to utilize at a later date when required. So along with the other patients, like the PCO patients, endometriosis, fibroids, these patients anyway have medical causes and they have to take medical help.
Right.
These are the other category of patients that are increasing in trend these days.
What is the biggest challenge a couple faces when they come for a fertility treatment, and how do they overcome it?
I think there are a lot of challenges in this country when it comes to medicine, and infertility is definitely no exception, right? The first challenge and the biggest challenge I have noticed in my practice is, Simrat, when a couple wants to plan a pregnancy, what do? They go to a
Gynecologist, right?
Now, is it wrong to go to a gynac and not to a fertility specialist? No, it's not a mistake.
That's the
first level, correct. When you go to a gynecologist, she's giving you some medication, she's helping you plan a pregnancy. You've tried for 6 months, 8 months, 10 months. And what do the couple do after that? They shift to another gynecologist. Okay. And what are they doing there? The same treatment, replay. Then to a third gynecologist. You will not believe, I had a patient who's been trying for 13 years and she comes with such a big file. I think she's visited every gynecologist in her district who have put her to the same kind of medication.
Right.
And she comes now at the age of 40. So this is the biggest challenge. You are reaching your fertility specialist late. If you reach your fertility specialist early, your chances of pregnancy are much higher.
Yeah.
So age is a major factor we want to stress on. So this is one challenge we have in the country, that the mindset is that they don't want to meet a fertility specialist. They want to try near a gynecologist, be it 5 years, 10 years or 15 years. So that is one big challenge. And the second challenge that I see is the information overload we have.
Right.
With Google, Facebook, Insta. Sometimes it's good to have information, be knowledgeable, but the amount of information that is available to patients these days, patients do not really know what to attribute to them. Everything that is there in the net is not their problem. And I have seen patients who have self-medicated, and this medication has actually done them harm than helping them.
But awareness is also such a big criteria of when to come to a doctor, when to come to a fertility specialist when you've been trying. What are those indications that a couple should know before they should come to a fertility specialist and not a gynecologist?
So when a couple has been trying for a long time and the patient is going to a gynecologist, she's trying naturally, she's not getting pregnant, you've tried for 6 months, 10 months, 12 months, you're a young couple, I'm talking about a young couple who's less than 35. So that is when you meet your fertility specialist. And why should you meet your fertility specialist does not mean that you have to start off an IVF treatment. So you're going there for an evaluation, basic evaluation, where the lady gets a simple scan done to see how the uterus is it all good to plan a pregnancy, how are the ovaries, what is her egg reserve, is there anything else in her uterus and the ovaries like the fibroids or the polyps, or the cysts in the ovaries which are preventing pregnancies from happening. And then one X-ray, which is called HSG, hysterosalpingography, where the tubes are evaluated to see if the fallopian tubes are blocked or open. And one blood test on day 2 of the cycle, where the fertility hormones are evaluated. So 3 small tests on the wife side.
Okay.
And when it comes to the man, one simple semen analysis with 3 to 5 days of abstinence. A lot of parameters are looked at in the semen analysis, but the 3 important things are the count, is the count good or not, and the motility of the sperms. So can we actually leave them for a normal pregnancy? And how many normal sperms are there? So these are the basic things. So once it's not working out, and now if I have a couple who's more than 35 years, I would definitely not want them to try for 1 or 2 years. 6 months down the line, you come, just get evaluated, make sure everything is normal, or if something is detected, your doctor will help you towards the directed treatment towards the problem.
Right. But since you're talking about general trends in infertility, has the societal perception really changed about infertility? Do you think couples come when they're open to taking the advice or the news of being infertile, or that they need extra help in becoming parents?
I think this is a very relevant question, Simrat, because yes, the trend is changing, but earlier it was like people do not want to hear that there is a problem.
Right.
And that is where they're not taking right treatments. So that part is changing quite a bit now. And people are willing to come get some evaluation done. But what I want to tell is you have to get evaluated at the right time. Evaluating a couple in their late 30s or in mid 30s and helping them get pregnant is much easier than evaluating the same couple in their early 40s or mid 40s.
Right.
So getting evaluated at the right time. And then, when we evaluate and tell the couple, if it is the lady who has the problem, I think the whole family is okay to accept it. Because it is always in their mind that a lady is not getting pregnant. So probably there's an issue in her.
With her only. Right.
But when we say that there is a problem in the husband, in his sperm parameters, it comes as a shocker. Now it's not just the husband or the mother-in-law who's shocked. Even the wives are shocked. How can my husband have a problem? Dear, your husband can have a problem. Your husband is a human being. So when we evaluate in the right way and you accept what the problem is and take treatment for it, you are on that road to pregnancy. And when you do not accept it, you're moving away from success.
Got it. I think there is also a big difference in understanding that it's that having a problem in male factor has got nothing to do with their sexual function. So I think that is a big difference where people fail to understand that it's important to get evaluated either as a female or as a male when you're trying to have a baby.
Correct. So true.
So doctor, with the advancements in the assisted reproductive technology, how do you think technology in IVF has evolved for the couple?
I think infertility treatments and advancements go hand in hand. And that's a blessing for the infertile couple. Simrat, what was considered an advancement yesterday is no more an advancement today.
Keeps evolving.
Yeah, tomorrow you have something better to offer to the patient. And this is a welcome thing in our branch. So we were always speaking about IVF, test your baby, IVF, test your baby. And then we had something called ICSI has come in, intracytoplasmic sperm injection. Before the advent of ICSI, especially when men had very few sperms, suppose there are just 10 sperms, the only option they had was going for donor sperm. Now, even if the male factor infertility is quite severe and the man is producing a couple of sperms, few sperms, you can use these sperms and help him father his own child. So that is the beauty of advancement, because you pull out the best possible sperm and help them form good embryos. Then we have something called PGTA, pre-implantation genetic testing of embryos. So what is basically done here? So we're testing for a genetically normal embryo. So with the changing lifestyles, delayed pregnancies, planning, late marriages, where we have this elderly couple coming in and trying to plan a pregnancies, because with age, the chance of having an abnormal baby increases, chances of miscarriage also increases. So when we're doing PGTA and transferring a genetically normal embryo for these couples, we're actually helping them towards pregnancy at a shorter time and helping them have a genetically normal baby and reducing the chances of miscarriage. So especially for these couples who are married late or people who've had multiple miscarriages earlier, previous IVF failures. So this comes as a boon.
Genetic testing does.
Genetic testing of the embryos.
Okay.
Then you have something called ERA, endometrial receptivity assay. So somebody has been trying IVFs multiple times, 3 times, 4 times. Every time they're taking good embryos transferred, all other evaluation done, and everything is normal. Now, when we do the ERA testing, what we're basically doing here, we're trying to screen for the window of implantation. So that means we are, in layman's words,
Right.
Trying to see what time should I transfer these embryos for that lady to have maximum chance to pregnancy. So when the window is altered, the multiple times you try, you're not going to fall pregnant. So we have to see what is this alteration and give her the transfer at her best time.
Personalized treatment. To
It's a
tell them
personalized
exactly.
treatment, right? So it helps them. And definitely I'll have to mention about the freezing protocols in hand. Right? Now we've moved from slow freezing to something called vitrification. So the freezing protocol is so good that you can freeze the sperms, the eggs, the embryos even for 10 years. And later you thaw, they survive, and you can help them plan pregnancy.
Okay.
So not just for patients who are cancer, especially the cancer patients before the chemo and radiotherapy. We do a sort of egg freezing, sperm freezing, so that they can use them at a later date. And social freezing, with changing timelines in their lives.
People wanting to prioritize other things and then...
Correct. Want to plan a pregnancy later. And with good freezing protocols in place, they can actually freeze their eggs and sperms at a younger age and utilize them later only if the need be. Now, once you're frozen does not mean that you will end up using these eggs or sperms, only if you have to. So I think, yes, the advancements are so many, and you can actually utilize them for the benefit of the patient.
But I think the intervention and the timely assessment is also very important.
So true.
That is the most important takeaway for everybody, that even though you're a young couple, you should get your fertility assessment done to be able to plan your life and your parenthood. Doctor, how does a couple react when they find out either one of them is infertile? How do they react to you?
So this is one biggest challenge I face in my daily practice, breaking it to the couple. And when it is the male who has a problem, nobody wants to accept it. I think the trend is changing. I don't say it is as bad as it was earlier, but still, the husband does not want to think that he's infertile. The mother-in-law does not want to accept. Even the wife does not want to accept the fact. But when I say the problem is in the female, it is taken up in a very natural way, because that is the general mindset that people have, that when a lady is not conceiving, it is her issue.
Right.
But that's not the case. So you have to understand the importance of evaluating the couple at the same time. So that is why it's very important to know that males also can have problems which have to be treated.
Doctor, how has the treatment in male fertility evolved?
I think this field of males infertility, there is a lot of advancement that has been happening on that field too. Earlier days, either they had to use their sperms or go ahead and use donor sperms if the problem was major. But then with advent of microsurgical treatments, we have something called PISA, TISA, micro-TISA. Now suppose there is a husband who's done his semen analysis and it says 0 sperms. The immediate option does not have to be donor sperm.
Okay.
So you can do certain hormonal evaluation, probably an ultrasound, do the basic screening, and then if they fall into the category where we can help them out with this microsurgical procedures. So what basically is done here, we are going into the testis, which is the production site of sperms, and if there is any sperm that is being produced, we are pulling it out and injecting it into the wife's egg, fertilizing the egg, and transferring this embryo back into the lady. So just as a normal conception where the sperm enters the egg and fertilizes it and leads to a spontaneous pregnancy,
Right.
Now we're removing the sperms from the production site, that is the testis, and helping them conceive.
Okay.
So I think this is a beautiful thing that people should know. You don't directly have to jump to donor sperms, and you can still father your own baby even if you're producing a few sperms.
That's very interesting to know how even male factor infertility has evolved over the years to help you father your own
So
child.
true.
Doctor, from your experience, is there any memorable story that stands out for you? Any story that you would like to share with the listeners which might be inspiring to them?
Yeah, I have such good stories to share.
I'm sure.
And I think every story gives you so much of contentment and happiness at the end.
And hope for
And
everybody
hope
else.
for the other couples.
Yes.
So true. I had this couple who flew down from abroad. The same thing I was telling now, azoospermia.
Okay.
That means in semen analysis, there were no sperms. So I've evaluated initially. And luckily, his hormones are not majorly altered. So TISA was done, sperms removed from his testis, and I could develop 3 to 4 embryos. I don't remember if it was 3 or 4, but good number of embryos.
Okay.
So the first transfer, I transferred 2 embryos. Now this was a couple who was told their only option is donor sperm, or else adopt the child, or you are not going to become parents forever.
Okay.
So I transferred these 2 embryos. So they had the first pregnancy, a girl baby, and then they come back again after 4 years because I've frozen the extra embryos. I had advised a single embryo transfer, but they were insisting on 2 embryos, so had to give them 2 embryos. And she had twins in the second pregnancy. This couple who were told that they cannot father or they cannot become parents with their own genetic material now have 3 living kids in their family.
Oh, lovely.
So that is the beauty of advancements. That is the beauty of getting evaluated at the right time and taking the right treatment.
Most importantly.
Yeah. So, there are so many stories like that where people have tried for 10 to 12 years, multiple failures. Then, I've done PGTA, screening of the embryos, transferred a good embryo. This is a very recent story. The lady is 42 years, the man is 44 or 45, married for last 5-6 years, and they have 2 IVF failures. So when they come down, I did the basic screening, but I told them age is a factor we're handling here. So let's screen the embryos, do PGTA and transfer a genetically normal one. And she has conceived in the first attempt, and she's in her 3rd month now.
Oh, lovely.
So yes, there are, and the contentment that comes, when you're helping these couples, I think that's unmeasurable.
I'm sure. Doctor, for couples who are just beginning to start their fertility journey, what advice would you give them to prepare themselves mentally or physically?
So when a couple is starting off the fertility journey, I want them to take this as a very normal process, just as you're trying for a spontaneous conception at home. So you need to understand, the first thing that is important is the basic evaluation. So just go to a doctor, your gynac or your fertility specialist, do the basic evaluation, see if everything is working out in your body right. A baseline scan, a HSG to assess your tubes, your baseline hormones, fertility hormones, and on the husband side, 1 semen analysis. Once you establish that everything is working out, the second thing I want these couples to understand is you're planning a pregnancy. So very important that you concentrate on your diet, a well-balanced diet. I tell my patients there is no wonder food. This one fruit you have or this one vegetable you eat.
That will help you, right?
That is not going to help you. You have to have a well-balanced diet. And this has to be something that you follow always.
Right.
Not just for 1 month or 1 week. And definitely the importance of exercise. You have to keep yourself physically fit. You don't have to shell out thousands of rupees, go and join in a fancy gym. Just 35 to 45 minutes of daily walk. If dance is something that interests you, switch on the music and jump to music.
Right.
And definitely the importance of mental health.
That's true.
Simrat, I think mental health is underrated in our country. And all these couples are under stress whether they accept it or not.
It is stressful for them, and that's where I feel the counselors at Nova do help.
So true.
They
so true.
talk to them and they are able to open up to them and, see the bigger picture.
And it is important for the couples to accept that, yes, they're going through this phase and it is good to take professional help so that you are helping yourself. Stress has such a negative impact on fertility management. I see couples, it gives us so much of stress in their marital stability also. So accepting that there is something called stress, mental health, concentrating on it is so important. And definitely cutting short on alcohol, smoke, substance abuse, I think these are the things, whether you're planning up spontaneously or reaching out to a fertility specialist and starting off your fertility journey, these are general things that have to be kept in mind.
Got it, doctor. What are the misconceptions or myths that you come across, that you encounter when you meet patients, and how do you...
I think there are thousands of myths and misconceptions.
What are the most common ones that have come to you and which you would like to also share with the listeners? Maybe they are thinking the same thing and that would help them.
Correct. The biggest misconception they have is when you go to a fertility center and you're doing an IVF, it's an abnormal pregnancy. It's not a normal pregnancy, so the baby is going to be abnormal. So this is a misconception they have. And how I tackle this is, when a couple enters the chamber, I want to sit with them, make them understand what this procedure actually is. So what are we doing here? We're giving the lady 10 days of hormonal injections. And these injections are routine female hormones that are being produced in every female. So when she understands that, she's okay to take these injections. And when she understands that these injections are going to help her produce more number of eggs. And once these eggs are removed from the body, the husband's sperms are processed and we're pulling out the best possible sperms and injecting these sperms into the eggs and forming the best quality embryo that is possible in their combination. So this is like a normal formation of the embryo, but medically we are trying to help them by pulling out the best quality sperms, increasing the number of eggs that are being produced. So when the couple understands this, that it is like a natural pregnancy that's happening in the body, it's not some abnormal pregnancy, so they're good to go with it.
Right.
So that is the biggest misconception they have. And the second misconception they have is the female is always infertile. It's never the male's problem.
Right.
But this trend is changing. I don't want to say males are not being cooperative. I think these days males are understanding.
As they should be, to
Yes.
understand that this is a couple's disease and
Correct.
not
Correct.
a single
Correct.
person's problem.
So that trend is coming down, but it's still there. I think in backward conservative societies or certain parts of the country, it is still there. It's not that that has completely vanished. So very important to understand that we evaluate the couple at the same time. Not treat the lady for 6 to 8 months and then the man comes, the semen sample shows no sperms. So what are we treating the lady for?
Right.
So important to understand, make them understand that we need to do basic evaluation at the same time. So I think these are the biggest misconceptions they have.
That's good to know, doctor. I'm sure the listeners have taken note of this as well. Lastly, looking towards the future, what are the developments or trends in fertility that you are excited about, and how do you see the field evolving?
I think there's so many advancements that are happening in infertility management and the treatments. I think one thing I'm excited about is AI. You have AI everywhere.
Right.
So AI is there in your life. So I think AI has entered the scanning machines. So it's helping us diagnose, do proper scans. And then AI is there in the lab. So AI does not do anything on its own.
Right.
So what it does, it helps us understand and pick out good quality embryos, and thereby increase the chance of conception.
Right.
So I think AI is something I'm looking forward to and passing on the advantage to all the patients there. And the second thing I want is, over the time, the change of mindset in people.
Right.
Where they stop thinking that it is something wrong to go to a fertility center or a fertility specialist. So meet your fertility specialist or get yourself evaluated at the right time, because what I see in most of my cases, had I handled this patient 5 years ago, it would have been an easy sale for them, and they've just reached me late. Right. So that is a change I want in the mindset, and I think we'll do good job for the patients.
Dr. Deepti, thank you so much. Your insights have been invaluable and so enlightening for the patients and listeners who are about to embark their journey towards parenthood. Thank you for being here today.
Thank you, Simrat. Thank you for having me.
And to our listeners, thank you for tuning into Fertility Tales powered by Nova IVF. Remember, every journey is unique and you're not alone. Whether you're just starting to explore your options or have been on the path for a while, we're here to support and guide you every step of the way. I'm your host Simrat, signing off. Don't forget to like, share and subscribe and spread the message.